Ariana Grande and 34 plus 35 on 102.7 Mom FM 843. Welcome to it. It's the morning show. Chris here with you. And so is in the studio Drew Dostal, President, Corewell Health, Ludington, and Gerber Hospitals. Good morning, sir, and welcome back.
Good morning, Chris. Thanks. It's been a while.
Yeah, it has. Well, welcome back to the studio, and we appreciate you being here. And you've brought somebody with you as well, the Rehabilitation Services Supervisor for Corewell Health. We're talking with Darren Guffey. Darren, good morning and welcome to the studio.
Good morning, Chris. Thanks for having me.
Absolutely. This morning we're going to be talking to the two of you. Darren, a little bit more about the rehabilitation services at Ludington Hospital. When I was looking over some of the notes in regards to preparing for this segment, one of the things that really jumped out at me as a runner is that you have this one of those gravity treadmills coming in later this year, right? Is that the plan?
Yes. We don't know exactly when, but sometime in 2023, a gravity eliminated treadmill.
All right.
Real fancy piece of equipment.
Absolutely. Yeah. Between that and the pool, you know, have you ever seen one of those pools where you're literally just swimming upstream, and that's pretty cool. But that helps recovery, and I want to chat with you a little bit about that and all the other services that are available at Corewell Health. Let's start this morning, though. President Drew Dostal of Ludington and Gerber, can you, before we even get into the big announcement, how are things going with our healthcare workers locally here and in the Fremont area?
Yeah, I think they're going quite well, Chris.
Okay.
You know, we have a good number of staff right now. It's spring, of course. That is a big player for everybody in West Michigan. Healthcare workers are no different. Mm-hmm. We really enjoy the spring. Looking forward to a busy summer with a push for Ludington's 150th anniversary. We're going to bring a lot of people into town. Yeah. So we're really gearing up in Ludington in particular. The volumes have been super steady in both hospitals. We never really saw much of a dip at all. It's been a very interesting year, a little different than our usual, mm-hmm. where in the winter kind of people go away, it gets quiet. Yeah. Hasn't really gotten quiet. It's been kind of interesting. And of course we have a lot of construction going on at Ludington, so you'll see the trucks out there, but it also kind of slows down our ability to put people up into rooms because we are so busy that we're going to hold people into the ER with actually our med-surg nurses coming down and covering them. So you'll be basically taken care of in a different location, but still being taken care of.
And a lot of things happening. We're talking about the cancer center that broke ground last year. That's making some movements, and just all the improvements to make sure that it's kind of a regional hospital, but this is our hospital that we rely on and go to, and when you walk in, it feels like you're in good hands here in Ludington.
That's absolutely right. We want you to have the same feel at every Corewell hospital that you enter, that you'll have the same experience. Mm-hmm. And part of that is making sure the rooms are up to date. So a big part of what we're working on right now is that second floor where we've taken the CCU that everyone knew and loved for 50 years. Is gone. It's a big room now, and so I just toured it 3 days ago, and everything's cleaned out, and they're starting to work on the new. So that's a phased approach, and that's going to take the upstairs will take better part of 18 months total when we're done. So we're not looking to be done with that until the early part of 2025. If you can think about 2025, mm-hmm. It's coming, but it's a ways out. And then the cancer center, we're shooting to be done with that at the end of the year, right around the beginning part of December, I hope, okay. Provided that supply and everything works out okay. And that has been a bit of a holdup, just like everybody else. So, but you're absolutely right. We want to keep people as local as we can. We're still providing the same care. As a matter of fact, we haven't changed what we can do in our cancer center at all lately. So everything's been the same, and we're able to see people and do all the infusions that people need right here.
All right. We're talking with Drew Dostal, President, Corewell Health, Ludington and Gerber Hospitals as well. Darren Guffey joins us this morning, the Rehabilitation Services Supervisor. We'll be talking about the rehabilitation services at Ludington Hospital in just a moment. The Corewell Health name, we're in this, 5-6 months now, I believe, roughly. But we're starting to see more of the imagery of that, more of the branding coming out. How's that development there?
Yeah, it's a slow phased approach. So you'll see it in some markets. In the South market right now, down in what used to be Lakeland Health, they're actually developing. They're the first one, so they're the first part of the phase, and then we're second. So we're going to be with the majority of the campuses in Grand Rapids. So you'll start seeing some changes. Tamarack has some changes coming up soon as well down in Fremont. So yeah, this summer we're going to begin to see some of those changes happen locally.
All right, sounds good. Let's move on to that big announcement. I know when we walk through the doors, one of the first things, and it's not going to disappear, but one of the first things is a mask station, right?
That's right. You know, everyone has gotten pretty used to walking into a hospital or any healthcare setting and seeing masks and hand washing stations when you walk in. They'll still be there, but we are happy to announce that of 6 a.m. this morning, we have gone mask optional. Okay. So if you feel a need to wear a mask, you should wear it. If you feel comfortable in going without a mask, then you're absolutely okay to do that in the hospital. We'll still ask you to do it in certain situations, as you would expect, for people who are at higher risk, of course. But generally speaking, it's an optional thing now. So a big shout out to the everyone who's played along and done what we've needed to do up until now. We're very thankful for you. And I want to do a special shout out to the healthcare workers out there who have worn those masks every single day for hours on end for 3 years. It's been an amazing thing that they've hung in there and done those things and tried to protect people as well as they can. And we used every tool we could, and that was one of them. So there'll be a formal announcement coming out with some of the larger healthcare systems in the South, and we're involved in that. But so is like U of M and Sparrow and some of the Southeast Michigan hospitals, so that everybody in that area is going mask optional.
Okay. Oh, so it's almost statewide in the sense, right?
Yeah, there are some pockets that you'll still find where they're asking you to wear masks. So do that. Okay. I mean, do whatever each hospital is asking you to do. I'm not sure what they're doing in some of the extended care facilities. So that's a vulnerable population as well. So we'll have to be sensitive to that.
Absolutely. And I think it's important for us to understand that when we go into the hospital and a nurse or the administrator or somebody that comes into our room, the doctor and such, if they ask us, to put a mask on, we should be complying with that. And it goes the same way if you feel like, hey, you want your nurse or your healthcare provider there to mask up. It sounds like one of the recommendations that you have is that the patients can ask that provider to mask up too, right?
Absolutely. Okay. We will respect that, of course. There are people who are much more comfortable with a close interaction if you have a mask on, and we're here to make sure part of healthcare is making sure that spiritually, holistically, emotionally, you're well, on top of the fact that we want you to physically be well. So we'll do whatever makes you feel most secure, and we're going to pay attention to that. So if you ask, we're going to put a mask on.
All right. And big news out of Corewell Health this morning that moving away from the masks as a requirement coming in. But there are some areas, and you highlighted this, continue to follow in some areas, especially like the long-term facilities, transplant clinics where masks are universally required, right?
Absolutely, yeah. Patients whose immunity has been suppressed for some reason, whether it's through an illness process or even a treatment process, you definitely want to make sure that you're doing everything you can to help them keep well.
And that's partly because over the last 3 years, the changes or the development and the of educating the healthcare workers on masks and the public in general, that's kind of evolved over the last 3 years too, right?
Absolutely. I see more Americans wearing masks now when they don't feel well, which is really a great thing. Yeah. If you have to stop in the store and you have a cold or you've just had the flu, throw your mask on before you go in. It's much appreciated. And, people are still wiping down shopping carts and different surface areas before they use them. And I think those are all still good behaviors, and I would encourage them far into the future because, we have to take care of each other. And a little bit of that good neighboring goes a long way. I think that's just very valuable for us to do.
And you've brought up a very good point. And if you're just joining us, we're talking with Drew Dostal, President, Corewell Health, Ludington and Gerber Memorial, as well as Darren Guffey, Rehabilitation Services Supervisor. A very good point. And I think I've seen this and felt it just in my own observations, is that there was a couple of waves of people sort of, I don't know if it's making fun of or pointing out or bringing attention to those that were masking up, and you had some polarizing on both ways. Now you have that evolving where if you have somebody that has a cough or a cold or congestion or sneezing and such, it's almost acceptable to mask up during that period of time when you are sick like that, so that that person can function. But now there's less of the pointing out or bringing attention to them in any sort of negative way. Have you felt that, or have you observed that as well?
Yeah, I do think that's true. I don't see people giving a double take to people wearing masks anymore. You just have to assume they have a situation in their life where they need to be protected or they need to protect you. Because if you're wearing, remember, early on, we talked about the difference between an N95 and a surgical mask.
Yes.
The surgical mask actually protects those around you from spreading droplets. The N95 protects you. So you'll see people wearing N95s who are maybe have their immunity compromised in some way, and they should wear those. You're going to get on an airplane or something like that, even though the air is circulated many, many times. It's not a bad idea to throw your N95 on if you have those situations in your life. Or if you don't feel well, vice versa, put on that surgical mask.
Absolutely, even if it's for just a couple of days to protect yourself and others. I think we're kind of, we've learned a lot about that, haven't we?
Yeah, it's a great practice, and it's probably something we should have been doing earlier on to even prevent the spread of the common cold.
Absolutely. We're talking with Drew Dostal and moving on to Darren Guffey. Darren, we're going to put you on the hot seat for a few minutes. Is that okay?
Deal.
All right. Sounds good. Rehabilitation Services Supervisor at Corewell Health. And I really want to dive in over the next couple of minutes about, and you can go deep into the services that are provided here with the Rehabilitation Services at Corewell Health, partly because just looking at the options available for the community, this is not something where when somebody comes through your doors, it's just an assessment, give them some recommendations, and so on and so forth. No, things can be truly treated, and we can get people back to where they were before, if not better, after stopping by Corewell Health, right?
Yeah, absolutely. We're a one-stop shop, everything rehab. We offer all the three main rehab disciplines, with physical therapy, occupational therapy, and speech-language pathology. Okay. We also have cardiac therapy, which is in the suite located directly next to us. So all in one area. We do cover both outpatient and we have an inpatient in the hospital upstairs, an inpatient staff. But yeah, if you're looking for just a one-time evaluation, we can do it. But 9 times out of 10, it ends up becoming a weeks-long, sometimes months-long treatment, depending on what the individual needs.
And rehab services, do you mind just exploring with us some of the scenarios that you've seen come through the door so that we can get people back to where they need to be? Is it more injuries? Is it more strains? Is it are you seeing more from car accidents? Where is the gamut in regards to that?
It is widespread. It's a little bit of everything. We're fully equipped to treat just about anything that walks through the doors. We have your typical kind of sprains and strains, low back pain being probably the most common for the physical therapy side. We have post-operative care. We have a lot of specialized clinicians at our site, which kind of separates us from a lot of clinics. We have a large site, both space-wise and also staffed. So when you get that many clinicians in one area, and we have a ton of tenure on our team as well, you get a lot of people kind of branching off and clinicians specializing in different areas. So at Ludington alone, we offer pediatric care for the kiddos. We have a handful of clinicians trained in pediatrics, and that covers anything from neurological issues, musculoskeletal issues, developmental things. We cover up to geriatrics. We have a balance program. We have a Parkinson's program, a really neat Parkinson's program that kind of spreads across all three disciplines, the PT, OT, and speech.
Okay.
Helps people with Parkinson's address kind of the major issues that come with the disease and get them back to functioning better, if not really, really well. We offer lymphedema treatment. We have a sports medicine team. We really cover, again, pretty much anything that walks through the doors.
And this is both outpatient and inpatient services. For the listeners and viewers, I mean, we hear these names, these categories, obviously inpatient and outpatient. But when it comes to rehab, can you define it a little bit more for us?
Yeah, that's a good question. You know, as a longtime physical therapist, I just kind of start to assume that everyone knows things that not necessarily true. So on the inpatient side of things, that's where we go into the hospital. We're attached to the hospital, so we have a team, and we really are all capable of going up and down and splitting between inpatient and outpatient. But we have kind of a designated inpatient team. So let's say you go in and you get a knee replacement, and you have to have an overnight stay in the hospital. We'll be in there likely day of to do our evaluation, education, start you on some light, easy exercises. And then before you go home, we'll come back in and we'll re-educate, make sure you got everything you need, make sure you can do stairs or walking or whatever it is you need to do to get home safely or go to the next place, wherever that might be, if it's not going to be home. And that goes not just for surgeries, but if you had even a 2-week stay in the hospital, we'll be in there on a daily or every other day basis, depending on what you need, to again get you up out of the bed, get you moving, and address those things to get you back to home or wherever it is you'd like to go. And then on the outpatient side of things, that's more of an elective thing. Your primary care doctor or surgeon or whoever it might be can recommend that you go do occupational therapy for, let's say, some nagging thumb pain you've had for 6 months. So you set that appointment up, you come in, you meet with one of our occupational therapists, and we do what's called an evaluation. That's your first time visit, usually about 45 minutes, hour long. And it's really an in-depth assessment of the issue at hand. Hopefully on that day we can provide some treatment as well, or at least get you rolling on some home treatment, get the ball rolling a little bit. And then that day is usually when we decide, okay, let's do 2 times a week for a month. Let's do once a week for a month. And we'll work with patients to decide that. That is on both parties to decide that. And then you end up in treatment for as long as you need. Our goal is to get patients back to functioning pain-free, or as close to that as we possibly can.
And can you actually, once you have an injury or something that happens, that nagging pain that you'd mentioned, or an accident, do you feel that we can get people back to 100%, or is that part of that rehabilitation that we're also kind of preparing them mentally that you might be 95%? What is those conversations like, if you don't mind?
Yeah, it varies from individual to individual. There are certain patients that come through and we can be pretty confident that we're going to get you pretty darn close to 100%. And we'll be transparent with that. If we feel that we can, we will say that. If we don't feel that we're quite going to get there, then we'll be honest. And then the goal becomes, well, let's get you as good as we possibly can, and then we'll set you up with the tools you need, whether that's exercises, stretches, to accomplish the rest of that recovery on your own upon discharge from therapy.
And how much does the mental drive of that individual factor into that process?
I would say considerably. There has to be some buy-in. If you come into the clinic even 3 days a week for an hour each time, that's 3 hours a week. In the scheme of things, that's not all that much time. So we put a lot of onus on what you do outside of therapy time. And we set you up again with all the tools you need. But if the patient is not compliant with their homework, we generally don't see as good of results.
Yeah, absolutely. We're talking this morning, Darren Guffey, Supervisor of the Rehabilitation Services at Corewell Health this morning. Let's talk about this newly renovated, right, remodeled 3,000 square foot rehab gym. That gives the tools for these individuals that are in these scenarios that we talked about over the last couple minutes, the tools for them to truly get back on their feet, to be able to move through that rehab process. What's the gym look like?
So about a year and a half ago, we remodeled and we almost doubled the size of our space, which was much needed. Again, having a big crew like we do. And so it's on the main floor, which is nice. No stairs to negotiate for those with the lower body injuries. So you walk in, you check in. We got a big lobby right there, and then when you get brought back, you'll be brought into a wide open big gym, basically with a ton of gym equipment, almost like a gym you would see, not quite to that level, but kind of a gym you'd pay for to go to. And then kind of off on the outskirts of that, you'll have different treatment rooms, private treatment rooms. If a patient would prefer to be kept away from everyone else, we can accommodate that. And then we have an occupational therapy suite. We have our speech language pathology connected, kind of down a hall, again, kind of tucked away because you need it more quiet. We have a pediatric room on that level. And then you would have to go upstairs to get into the hospital for our inpatient folks.
All right. And you mentioned this a couple of times over the last few minutes, and I think it's important to highlight is that with the amount of physical therapists and staff members there, you really can provide that 1-to-1 ratio, right?
Yes, okay. Which really kind of sets us apart from a lot of different health systems and privately owned clinics. We do one-on-one care only, so you will never be double booked with another patient when you come in for any of the three services, PT, OT, or speech. It is always going to be one-on-one direct patient care, which really improves the quality of care.
All right. Good information there. And for anybody that with the PT, you work with moving your arms and legs, bathing, grooming, or strength coordinating, the occupational therapist, that's where you're talking about daily living and that bathing, grooming, independent living skills, and then speech therapist, obviously being able to cover the swallowing as well as communication. And that can all be handled right there right here locally, right?
Yes, absolutely.
Okay.
Like I said earlier, one-stop shop. We can cover all three of those things, and you can even kind of cross-treat into multiple disciplines. If you need speech and you need occupational therapy at the same time, we can make that happen. And it's a beautiful setup for that. And again, also sets us apart, where a lot of clinics cannot offer all three in one area.
All right. And one thing I mentioned early on of our segment, and if you're just joining us, you can watch this on our Facebook page and our YouTube channel. And if you missed any of this segment, you can watch that there. It's archived after the segment's over. But you have the Alter G gravity eliminating treadmill coming in sometime here in the near future. And if anybody's ever seen one of those, truly it takes the weight of the pounding of your knees and your feet and everything else, and you're able to take that weight and really focus on the strength training and rehabilitating. Take us through what and how important that's going to be for your process from a therapist standpoint.
Yeah, we are extremely excited to get this piece of equipment. It's hard to come across, and it is a very useful piece of equipment. I was fortunate enough to use one at one of our other Grand Rapids locations a couple of years ago. So you picture it like a treadmill. Looks a lot like a normal treadmill, except it has a big old bag connected to it. And you then the patient will put on shorts, which zip into that bag. And then the treadmill does really all the work for you. So it kind of zeroes the patient out. It'll inflate so that you come up and you're not weight bearing as much. And then it zeroes you back down, and you say, well, I want this patient who is a month out of a knee replacement and has a really bad limp. I want to work on correcting their walking. We call their gait. Okay. And you say, but with full weight bearing, they're struggling to do that. It's just too painful. So let's try 50% weight bearing. Okay. That bag inflates to 50%, and it's an odd feeling. I've been in it myself. If you get it really inflated, you feel like what I would imagine is walking on the moon.
Yeah.
It takes a little getting used to, a couple minutes, and then most patients have that aha moment of, man, I can walk, and I can walk with minimal to no pain here. Cool. And that gives us the ability then to critique walking mechanics, and then as patient progresses over the weeks, months, whatever it might be, we can slowly, gradually increase the amount of weight that the individual puts through their foot or their knee or their hip and get them back to walking on in normal environment with minimal to no pain and good walking mechanics.
All right, that slow process or progress, or even it could be, but it's either way, it's at their speed. And without a ton of pain too, or at least minimal pain, and I think that's a great feature that's going to be there. Darren, I appreciate you talking about that. Is there anything that we missed to relay to the listeners and viewers in regards to rehabilitation services at Corewell?
No, I think it's just I want to put a plug in for the team. We have again a large team, but we have a very tenured team, a very close knit team. I think when you have people that have been working in the same place for 15, 20 plus years, and a lot of them, that alone speaks volumes for the team dynamic. We work very close together, and I think because we're in the smaller town feel, we know a lot of patients, or we know people that know patients, and that gives you a greater sense of accountability to help people. So we kind of join together, and you get a whole lot more accomplished with patients with anything when you work as a big team. So that's been our approach, and will continue to be moving forward.
Great message there. Drew, let's wrap up with just the idea of listening to Darren for the last few minutes and talking with you earlier in this segment about the second floor remodeling. We talked with Darren about the new remodeling of the gym. We've got the cancer center coming up. You've got the rebranding of Corewell. There's a lot of changes happening, but it sounds like they're all for the good, right?
Everything we're trying to do is setting us up for the future, to just make sure we continue to provide the great care we can for our communities, and with community input, things that people need, and the population studies that we do on that are directing our growth. So we're trying to make sure that we're being useful as we really want to be for the community. This is our community too.
Of course. Drew Dostal, President, Corewell Health and Gerber Hospital, as well as Darren Guffey. I appreciate both of you coming in this morning. We'll have you back on here in the future as the developments continue there on Jackson and Ludington US 10 there. You see the big crates outside, but the construction continues, but people can still comfortably go into the hospital and now comfortably either wear their mask if they want to or not. That's a big announcement coming out this morning. So, Drew, thanks for coming in this morning.
Thanks so much, Chris.
Absolutely. And as well, Darren, we appreciate you coming in as well. And I think you said something very important that we want to reiterate is thanking the team for their longevity at Corewell Health, helping us here in the community. So thank you for coming in this morning.
Yeah, thanks for having me. I appreciate it.
Absolutely. 9:11 now on 102.7 Mom FM. Stick with us. News and weather coming up next on Mom FM.
Thanks for making us